Well, dental veneers has changed over the years. So dental veneers used to be cosmetic, and people would actually get them. They were like lip press on nails, for example, right? And what we found with those kind of prepless veneers is they shatter, and they also have common problems. So veneers used to be cosmetic, but now we do veneers for a lot of different reasons. People have spaces, chips, they have cavities between their teeth in the front area. Veneers we actually prepare differently now to achieve an aesthetic result, but also making the tooth whole. So we can actually take a patient that has a lot of fillings in the front, and instead of replacing the fillings or doing aggressive full crowns, we can actually take impressions, design what the veneers will look like, and the lab will prepare and let us know how to prepare the teeth in order to achieve the results we're looking for. So veneers are actually, nowadays, about 80% of veneers are done for functional reasons, but you aesthetically get the aesthetic effects as well. So it's like you get the best of both worlds, I guess. And there are actually a couple points to veneers. Is you want to make sure that you go to a cosmetic dentist who's trained in veneers, and you also want to make sure that they're designing your case, and you also want to make sure they're using a cosmetic lab. Half the veneers we do are done because the doctor didn't prepare them right, they didn't design it right, and they used a general laboratory, which cannot compare to a cosmetic laboratory. Because laboratories are trained to make things beautiful and translucency and texture and all the love that a veneer needs. So I think half my business is replacing other people's veneers. And while the preps may be okay, I usually ask their experience, and the patient had no control of what they look like. So when you're choosing a cosmetic dentist, where did you get trained? What school did you go to? We don't have enough time to train veneers in dental school. So when they come to, there's a couple different schools that we teach veneers actually. And one of my schools is here in town, where we teach doctors how to design a case. And so when you go in and have the veneer preparations done, you're actually able to walk in on temporaries that look exactly like the new ones are gonna look like. I mean, I've had people get married in my temporaries, and they're absolutely gorgeous, but it gives the patient a sense of trying their smile on before the veneers are made by the cosmetic laboratory. And laboratories are huge. Not all laboratories are created equal. So a lot of times I get customers that come in for consults that, oh, well, the price over here was $8,000 for a veneer set, but there's a cosmetic dentist in Scottsdale that was $22,000. Which one's better? Well, the training, one, and two, the cosmetic dentist is probably using a cosmetic laboratory. So the laboratory a lot of times dictates the price of the veneer you get. So I would probably suggest that don't shop around on price, shop around on quality, where the training was, and always make sure that the laboratory that the doctor is using. Well, if you have a smile that you're unhappy with, we can define what are some things that make you unhappy. So general dentists typically will do 1 or 2 or 4 veneers in the front, and then they try to blend and match the rest of your teeth. A cosmetic dentist will do 8 or 10 set, period, right? So we can build them all unified, the veneers will not stain or discolor, and we can correct whatever discrepancies you look for. So if you got chips in your front teeth, you got a big space in your front teeth, and there's things, maybe you have some crowding and you want to relieve it. Most of the times those are for functional reasons, not aesthetic, but we want to be able to handle both. Fix the function and handle aesthetics so you have a great outcome. So the candidates, if you have fillings in your front teeth that are plastic, you have some chips and spaces that maybe a doctor tried to get creative and try to build out with composite, which is not really a taught procedure in dental school, you could be a candidate for veneer set. So I would say go in for a consult, make sure they're designing the case, and make sure you know the information about who's doing what and when.